When most people think about foot health, they tend to focus on the symptoms they feel: sore arches, aching heels, or stiff ankles. But beneath those sensations lies something more complex and often overlooked: biomechanics. Biomechanics refers to the way the body moves, particularly how bones, muscles, and joints work together to support motion. In the case of the feet, it involves how they absorb shock, distribute weight, and propel the body forward with each step. The truth is, foot function doesn't just affect the feet. Poor biomechanics can have a ripple effect on the entire body, contributing to knee pain, hip strain, and even lower back problems. That's why identifying and correcting biomechanical issues is so important, and often the key to long-term relief from chronic discomfort. The feet are the foundation of nearly every physical activity a person does throughout the day, from walking to climbing stairs to standing for long periods. Each foot has 26 bones, more than 30 joints, and over 100 muscles, tendons, and ligaments, all working together to provide support, balance, and flexibility. When everything is working correctly, the foot moves in a smooth and efficient way, helping the body stay aligned and balanced. But when even a small part of that system goes off track, whether due to flat feet, high arches, muscle imbalances, or improper gait, it can throw the entire kinetic chain out of alignment. That's when problems start to appear, not just in the foot but further up the body. For example, if one foot rolls inward too much during walking, a condition known as overpronation, it can cause the ankle to shift, the knee to twist, and the hip to tilt. Over time, this can lead to aches and injuries that seem unrelated to the feet at first glance. The same is true in reverse. Correcting the way the foot functions can have positive effects on posture, balance, and comfort throughout the body. There are several common biomechanical issues that podiatrists see on a regular basis. Overpronation, as mentioned, is a frequent one. This condition causes the arch of the foot to collapse inward, putting strain on the ligaments and tendons. It's often seen in people with flat feet or weak arch support. Supination, or underpronation, is the opposite problem. In this case, the foot rolls outward too much, placing excessive pressure on the outer edge. Supination can lead to ankle sprains, stress fractures, and instability. Other issues include leg length discrepancies, which can affect the balance and rhythm of walking, and abnormal gait patterns, such as toe walking or an uneven stride. These may be caused by muscle tightness, past injuries, or neurological conditions, and they often require professional evaluation to diagnose correctly. No matter the specific condition, biomechanical problems often lead to symptoms like heel pain, arch discomfort, forefoot pressure, and general fatigue in the feet and legs. Over time, if left untreated, they can lead to more serious conditions like plantar fasciitis, Achilles tendonitis, or joint degeneration. The evaluation also includes a physical exam, looking at foot structure, muscle strength, joint flexibility, and range of motion. Sometimes, imaging tools like high-resolution digital X-rays are used to examine the bones and joints for structural abnormalities. By combining visual observation, physical assessment, and imaging, podiatrists can pinpoint the root causes of pain and dysfunction. The goal is not just to treat the symptoms, but to understand how and why the body is moving in a way that leads to those symptoms. Once the source of the biomechanical problem is identified, treatment can begin. The right solution depends on the cause and severity of the issue, but many cases can be improved with custom orthotics. These are specially designed shoe inserts that correct the alignment of the foot, redistribute pressure, and support the arch. Unlike generic store-bought insoles, custom orthotics are made from a mold or scan of the patient's foot, ensuring a precise fit and more effective support. Physical therapy is another valuable tool in biomechanical correction. Targeted exercises can strengthen weak muscles, improve flexibility, and retrain the body to move more efficiently. For example, stretching tight calf muscles, strengthening foot stabilizers, and improving hip mobility can all contribute to better foot function. Even for people who aren't currently in pain, a biomechanical evaluation can be valuable. Athletes, runners, and active individuals may use it as a preventative tool to avoid injury. People with a history of foot problems in the family may want to catch issues early. And older adults can benefit from ensuring their foot function supports safe, stable movement.